So, hi students, welcome to the platform of eGurukul and Dr. Bhatia Medical Coaching Institute. I am Dr. Ramyasree, your Obgyn Guru. In this video, we will going to have a quick revision about the infections in the gynecology. So, I'm going to discuss about vaginitis, ulcers, right, and cervicitis in brief in this video. Okay. So, vulvovaginitis is inflammation of the vulva and the vagina. It can be either physiological or it can be pathological. So physiological, we have prepubertal vulvovaginitis due to some foreign bodies or postmenopausal due to absence of estrogen. So that is called postmenopausal or atrophic or senile vulvovaginitis. Pathological or infectious is we have Trichomonas, Candidiasis and Bacterial vaginosis. So Trichomonas vaginitis is caused by Trichomonas vaginalis. Candidiasis is caused by Candida albicans. Bacterial vaginosis is due to alteration of the microflora. So I'm going to discuss about all those three now in this video. So starting with Trichomonas vaginitis. So Trichomonas vaginitis is caused by Trichomonas vaginalis. It's caused by Trichomonas vaginalis. This is a sexually transmitted disease. That is, both partners have to be treated irrespective of whether there are symptoms in the partner or not. So you will see greenish colored discharge plus itching plus dysuria and dyspareunia. So symptoms will be greenish colored discharge plus itching plus dysuria and dyspareunia. And when you see the signs, you will see the punctate spots or the strawberry vagina or angry looking vagina. So vagina will become red color and there will be spots, punctate spots, red color spots seen in the vagina. Okay. So this is the perspeculum strawberry cervix, what you will see, a very classical of the Trichomonas. So coming to the investigation of choice is saline microscopy, where you will see the flagellated protozoas. And gold standard is culture. So culture you can do in the Feinberg's Whittington media or the diamond media. So these are the Trichomonas, pure shaped Trichomonas which you are seeing here. So these are the pure shaped Trichomonas. So there will be the flagellated Trichomonas. Now coming to the management. So drug of choice is metronidazole 2 grams single dose or tinidazole 2 grams single dose orally. You can also give metronidazole 500 milligrams BD for 7 days. So you have to treat both the partners. So you give metronidazole 2 grams single dose or tinidazole 2 grams orally single dose, or you can give metronidazole 500 milligrams BD for 7 days. You have to treat both the partners. Okay. So pregnancy we avoid the oral drug. So you can give metronidazole pessary. Second and third trimester you again can give them metronidazole 2 grams stat dose or 250 milligram TDS for 5 days. So basically the drug of choice is metronidazole and you have to treat both the partners. So coming to the candidiasis, candida is mainly caused by Candida albicans. It's also less commonly caused by Candida glabrata and Candida tropicales. This is the only organism which can flourish in the acidic medium. So that is why it is the most common vaginitis of pregnancy, diabetes and immunocompromised. So it is the most common vaginitis in pregnancy, diabetics and immunocompromised, right? So this is the classical, the curdy white discharge or the cottage cheese like discharge. So this is the clinical picture what we have. So this is the curdy white discharge or paneer like discharge. So pruritus will be plus. There will be a lot of itching. So on examination, we'll see white colored punctate spots on the vagina. Next, saline microscopy. You will see the pseudohyphae. Gold standard is culture on the sabroids agar. Drug of choice is mainly the azole group, such as you can use the fluconazole 150 milligram stat. So you can use fluconazole 150 milligram stat. So this is the very classical appearance on the pap smear. So this is called as sheikh kebab appearance. So on the pap smear, you will observe the sheikh kebab appearance. So that is, you will have a pseudohyphae and around the pseudohyphae, the epithelial cells are wound around. So that is why this is looking like a sheikh kebab. Okay. Next. So what is this recurrent vulvovaginal candidiasis? So recurrent vulvovaginal candidiasis is defined as 4 or more episodes of candidiasis in a year. So management is fluconazole 150 milligrams every 3 days for 3 doses, followed by 150 milligram weekly for 6 months as a maintenance therapy. And most important is you have to treat the underlying cause. Unless until you treat the underlying cause, they can have this candidiasis again and again. So recurrent vulvovaginal candidiasis, you have to treat the first underlying cause. Next, coming to the bacterial vaginosis. So bacterial vaginosis is the alteration in the microflora of the vagina. So here, alteration of the microflora in the vagina is due to Gardnerella vaginalis, which is the most common. It can be due to mycoplasma, peptostreptococci, and bacteroids. It is also due to mobilincus, prevotella, urea plasma, urea lyticum. So what happens is this bad bacteria increases and the good bacteria decreases. So it is the alteration of microflora, most commonly due to Gardnerella. So symptoms, they'll present to you with dirty, white, malodorous smell, discharge, smelling discharge. But important point, guys, there is no pruritus. Unlike your candidiasis and trichomonasis, here there is no itching, There's only dirty, white, malodorous discharge. Very important for the diagnosis of bacterial vaginosis is Amsel's criteria. So what is this Amsel's criteria? So 3 out of 4 should be positive. So they should have dirty, white, foul smelling discharge. pH should be more than 4.5. When you apply 10% KOH, you will have fishy odor, that is whiff test positive, and clue cells will be positive. So Amsel's criteria mein dirty, white, foul smelling discharge will be there. pH will be more than 4.5. When you apply 10% KOH, fishy odor will be seen and clue cells will be positive. Okay. Next. So you can also do Nugent scoring. So Nugent scoring is where you will see that lactobacillus is decreased and Gardnerella is increased. Treatment for bacterial vaginosis is also metronidazole. So metronidazole 500 milligrams BD for 7 days. So treatment for bacterial vaginosis is also metronidazole. Okay. So what are the clue cells? So this is how the clue cell will look like. So these are the clue cells which are bacteria attached to the vaginal epithelial cells, right? So this is about our 3 main important vaginitis. So greenish discharge associated with pruritus, trichomoniasis, curdy white discharge associated with pruritus, candidiasis. Only foul smelling discharge, no pruritus, is bacterial vaginosis. Okay, right. So next, coming to the cervicitis. So cervicitis is mainly caused by chlamydia and gonococci, guys. Cervicitis is mainly caused by chlamydia and gonococci. So etiology mainly it is chlamydia trachomatis D2K. So chlamydia trachomatis D2K. So it's an obligate intracellular organism. So it mainly infects the columnar and the transitional epithelial cells. Okay. So Neisseria, gonorrhea and chlamydia are usually, both stay together. So they can also often associated with Neisseria. So infection will be again going to urethra, Bartholin gland and cervix. So when they ascend upwards, they can cause acute PID. When they ascend upwards, they cause acute PID. So what will be the clinical feature? Most of them are asymptomatic. 80% of them will be asymptomatic. The main presenting feature will be mucopurulent endocervical discharge. Mucopurulent endocervical discharge. So urethral symptoms will be dysuria, frequency, pyuria, no bacteria. So pelvic pain, and they'll have postcoital bleeding or intermenstrual bleeding. Okay. So next investigation may you can do nucleic acid amplification test. That is the most preferred. First void sample or the vaginal swab. You can also use PCR. You can culture, but culture is very difficult and culture is usually on McCoy cells or HeLa cells. So preferred is nucleic acid amplification. So this is the mucopurulent discharge of the chlamydia. So this is how the chlamydia cervicitis will look like. So red cervix with mucopurulent discharge. What is the drug of choice? You can either use doxycycline or azithromycin, but doxycycline is a prolonged you are going to use. So that is why preferred is azithromycin, because it is a single dose. So doxycycline will be 100 milligrams BD for 7 days. Whereas azithromycin is only 1 gram single dose. So azithromycin is preferred over the doxycycline. So you can also use single dose of azithromycin as it is similar. Treat both partners simultaneously as this is also STD. In pregnancy, again, it is only azithromycin. We don't use doxycycline there. Okay. Now coming to the gonorrhea. So gonorrhea is caused by Neisseria gonorrhoeae. 50% are asymptomatic. Again, it will also cause the irritant mucopurulent discharge. Apart from that, they'll have lower abdominal pain, urethral infections like dysuria. This can cause Bartholin gland infection. So it can cause Bartholin cyst, guys. So it can cause Bartholin cyst. And it can also cause gonococcal vaginitis in the newborn. It can also cause gonococcal vaginitis in the newborn, right? Here also, gram stain and culture, you can see where you will see gram negative diplococci, and you can go for nucleic acid amplification test. So here also you can do nucleic acid amplification test. Culture will be on Thayer-Martin medium. Culture will be on Thayer-Martin medium, right? So nucleic acid amplification test will be preferred. So it is very sensitive and specific. For gonococci, what is the drug of choice? For gonococci, the drug of choice is, so this is the gram negative diplococci. It is intracellular. That is why it is present inside the cells of the You cannot pick up the gonococci on a pap smear. So treatment will be single dose of injection ceftriaxone 125 milligrams IM stat or cefixime 400 milligram oral stat or ciprofloxacin 500 milligram stat. So preferred will be injection ceftriaxone 125 milligrams IM stat. Preferred will be ceftriaxone 125 milligrams IM stat. Okay. So in pregnant, you can give the cephalosporin regimen. If patient is allergic to beta-lactams, then you can give 2 grams of spectinomycin IM. Okay. Next, coming to the, so in cervicitis, we mainly spoke about the chlamydia and gonococci. Now coming to the vulval ulcers. So vulval ulcers will be, there we have painful vulval ulcers, we have painless vulval ulcers. So painful vulval ulcers you can remember mainly by high coat. So that is herpes and chancroid. Herpes and chancroid. So herpes is mainly caused by HSV2. Herpes is mainly caused by HSV2. So they will mainly present you with many vesicles, multiple vesicles, small red color vesicles it will be, and then they'll burst out. So they are very painful, guys. So multiple, they'll have erythematous base. Edge will be also erythematous, bilateral tender lymph nodes will be present, and the treatment will be acyclovir 400 milligrams TDS for 7 to 10 days. That is for the herpes. Now coming to the chancroid. So chancroid mein what is happening? It's a soft canker. Chancroid is also called as soft canker. So this is caused by Haemophilus ducreyi. They'll present you with papules which can be multiple. So base will be grayish with pus exudate. Undermine edges. They'll have unilateral tender lymph nodes. Treatment will be azithromycin 1 gram per oral. Treatment will be azithromycin 1 gram per oral. Okay. So coming to the herpes. Herpes is mainly caused by HSV2. Vesicles will be there. Multiple erythematous base, erythematous edges and bilateral tender lymph nodes. So drug of choice will be acyclovir 400 milligrams TDS 7 to 10 days. Chancroid or the soft canker is mainly caused by Haemophilus ducreyi. They mainly present you with papules. So usually you will have multiple. So they will have grayish exudates, undermine edges, unilateral tender lymph nodes. So azithromycin 1 gram per oral will be the treatment. Okay. Next coming to the painless ulcers. So painless ulcers may we have, so painless ulcer may what we have is, we'll have syphilis and heart canker. Syphilis or the heart canker. So this is caused by Treponema pallidum. So usually it is a papule, it is a single papule, right? So they'll have punched out edges. So there will be rubbery and non-tender lymph nodes. So they will have rubbery, and syphilis may you'll usually have rubbery and non-tender lymph nodes. Rubbery and non-tender lymph nodes. So drug of choice is injection benzathine penicillin 2.4 millions IM. So drug of choice is injection benzathine penicillin 2.4 millions IM. So next painless is lymphogranuloma venereum. So lymphogranuloma venereum and granuloma inguinale are also painless. Right? So lymphogranuloma venereum is caused by Chlamydia trachomatis L1, L2, L3. Whereas granuloma inguinale is caused by Klebsiella granulomatosis, or it's also called as Calamytobacterium granulomatosis. So this is a papule or vesicle. This is mainly a papule. So this is a single ulcer. Here it can be single or multiple. So base can be red velvety base and which bleeds on touch. So both, this is very classical. Many times they ask you about the granuloma inguinale. So you have a red velvety base which bleeds on touch. And when you scrape the ulcer, you will see the Donovani bodies. Donovani bodies. So both edges are well be elevated. Both, this has tender lymph nodes, and when you see between the lymph nodes, you will have groove sign positive. Whereas granuloma inguinale may pseudobubos will be there. In both of them, drug of choice is doxycycline. So doxycycline 100 milligrams OD for 21 days. So that is about the all infections which are important and which we should be knowing. So we have discussed about the different types of ulcers here. So painless ulcers are syphilis, lymphogranuloma venereum and granuloma inguinale. Painful ulcers, remember with high code, that is herpes and chancroid. Okay. So that's about the infections in gynecology which are important to us. So thank you guys. See you in the next video.